All right. Hey, hello, everybody. Welcome back to another episode of your favorite podcast, Mind Your Body and Soul, the Healthy Podcast, brought to you by Neighborhood Medical Center and our Ryan White program. I am Joseph Ward. I'm joined by my homie, Mr. Mathias Sweet. Tell him what's up. And
Everybody.
Dr. Staples. She earned her name in the street, but
Hi.
Miss Elena Steeple, our guest host, is definitely here with us today. And we have a wonderful show. Before we get to our guest, let me do some housekeeping. Remember that Mind Your Body and Soul, the Healthy Podcast, is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of ourselves. And we are available every Wednesday, of course, at our website at nmcpodcast.com, or you can go through the home website at neighborhoodmedicalcenter.com/NMC podcast. We're also available every Wednesday on our Neighborhood Medical Center YouTube channel. So go subscribe because, YouTube and all these other platforms, they have this special thing that when you're watching the video, if you like it, you comment, you subscribe, and you share it, more people can see it. So make sure you all do that. We're also available on anchor.fm, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. So y'all make sure y'all go check us out, subscribe, so you can get this healthy information every week, because it's our goal to make sure that we deliver as much information as possible. All right. So I'm going to throw it to Mathias because he's going to introduce today's guest.
So I get the great opportunity today, guys, to introduce my supervisor, one of the best doctors that we have here at Neighborhood Medical Center, who loves the toughest cases. The most intricate thing you can find is what she's going to love most about it. She don't mind the simple patients, but she really, really loves those complex patients. The ones that she can get really down and dirty with and see what's going on and find out these different things. So the perfect thing about today's thing is what she likes doing. She loves this stuff about the researching. And y'all thought Miss Steeple researched? Mm-mm. We got another one right here with you. So without further ado, I have Dr. Sharon Foster, our Neighborhood Medical Center Medical Director.
Thank you. Thank you for having me today.
You're welcome. Thank you for being here today. So we're going to go ahead and get right into it. So Dr. Foster, can you tell us some insight onto your journey on becoming a medical doctor and why you chose to become a medical doctor?
Well, I could tell the long version, but I know Elena will get bored, so I'll tell the short version.
Never.
Actually, when I was in high school, I found that I was attracted to biology and the biological sciences. And once I entered into college, I started to get cold feet and wondered if I really was, made up to be able to go through to medical school. But I continued as recommended by my parents. And as I continued, I found that I really did enjoy biology, math, chemistry, all the topics that would make me successful into entering medical school. And what pushed me over the edge was in my junior year, I was able to do like a little internship at the medical school, Rutgers Medical School, and that sealed the deal.
Okay.
Yay.
Rutgers Medical School.
Right.
I see you.
Look, just because you went to Rutgers, Joe, don't mean Rutgers College.
No, it just Rutgers is
Rutgers
a good school.
Pretty nice
it
school.
produces a lot of great people. So
yeah, it's a great school.
All right. So one of the reasons we wanted to have you on here, because we were thinking about who would be the best person to talk about COVID, and your name came right up. So, and we know that you have a passion for the flu, helping others learn about the flu, and now COVID virus. So most of us really believe that we know about these medical conditions, diseases, viruses, the flu main one, because a lot of people, I've had the flu, so people really think that they're experts on the flu.
Mhm.
So can you explain to us exactly what the flu is and how it affects the body?
Well, the flu is short for the influenza virus. And the influenza virus is responsible for seasonal epidemics, usually once a year, around starting in the beginning of October all the way through typically February or March. We have the flu season where you have the two most common causes that infect humans, which are the influenza A and the influenza B. The influenza A can break down into different subtypes. So, for example, if you have an influenza A virus, you can have different subtypes. When they make up the flu vaccine each year, they try to predict which of the subtypes of A or even influenza B will be more prevalent. So in the summer, they usually start making up the vaccines to prepare for the winter distribution for that year. And in terms of how it infects the body, usually the virus which is very contagious. It enters in the body either through one of the mucous membranes, for example, in the nose, the throat. And once it enters the body, it can infect the nasal passages, the throat, to cause pharyngitis, and sometimes it can go into the lungs and you may develop pneumonia.
So it's important to understand the mucosal membrane, where they exist and how they can be affected by that.
That's correct.
Yes, ma'am. Okay.
Okay, well, I guess it's my turn. I was told to stick with the script, so I'm going to stick with the script. But I will say during this time, it kind of sort of becomes confusing with a lot of the HIV patients, the acutely infected, because the symptoms of someone who is acutely infected with HIV is almost mimics its mirror image of the flu. And so I'm so glad talking about that today, because if you are experiencing symptoms like that, you really need to come in and get tested. So I'll stick to the script, Dr. Foster, but
it's okay. You can go off script. I'm here to answer any questions.
Okay, so I will just ask this one question. Then what do you recommend for someone during this time of flu who is experiencing the scratchy throat and the runny nose and the body aches? What would you say to them?
What I would say is that if the symptoms are persistent and not going away through over-the-counter remedies, go in to see your primary care provider, because it may be something that might be a simple virus. The influenza virus is one of zillions of viruses. So it may not be a virus that is going to linger forever, but if you're not feeling well and you continue to have symptoms that are persistent, you do need to go see your provider.
Okay. Well, I just took a little veer off, but my question is, with the world having its attention zero in on COVID-19, why is it still important for us to remain vigilant in reference to the flu?
Well, with any infection that infects the body, your immune system is going to respond. And during that during the phase of when your body is responding, your immune system is attacked. So it's low in terms of your ability to react to anything else that is more infectious. And in that sense, it's very important to make sure that you do protect yourself once you have any sort of infection, to protect yourself from becoming what's called super infected, where a different organism can take over, and that organism that takes over may be more serious and potentially more deadly.
Ah, that's interesting. Okay.
So in that, you're talking about co-infections as well. So having maybe the flu, or just use flu and coronavirus at the same time could be considered a super infection.
Yes.
Okay.
Or if you have the flu, you may develop a bacterial infection, which is more serious, because that can become more overwhelming and more pronounced, and it can infect the lungs and lead to sepsis, where it gets into your bloodstream. So it's very good to make sure that at the initial infection right away.
Yeah, so that's like the pneumonia and like bronchitis and things like that would affect the lungs, that would really cause more problems with the flu itself.
Yes,
Okay.
that's correct.
Okay.
So we know that the flu affects everybody. Which population is really more affected? You know, some say that certain demographics and certain income levels and poverty levels are affected. What type of population is really affected worse by the flu? Or is that more risk?
Okay. The people who are at risk for the flu are the same population that are at risk for COVID and any other potentially deadly infections. So that category would include people aged 65 or older, people with any underlying medical problems such as high blood pressure, diabetes, heart disease, any chronic respiratory problems such as emphysema, chronic bronchitis, any person who has any chronic renal problems, cancers, sickle cell is another major disease, pregnant women. And interestingly enough, there have been studies that shows that people who have a BMI over 30 tend to be in a high risk category, as well as people who are immunocompromised, such as persons with HIV or any organ transplants, people who are on chronic steroids, any medications because of organ transplants, people who have had a bone marrow transplant. So anywhere where the immune system is not as robust as it should be would be considered high risk.
Okay.
Okay.
And it is interesting, because I'm just starting to nerd out over viruses and stuff, hanging around this people. It's always interesting to see how the viruses work in the body, especially with the compromised immune system, because I understand what you're saying. Because it seems like the people who we would normally see the most, the people who would normally treat the most, the people who we would conduct outreach on the most would be the most affected by the flu and or even coronaviruses, because of pre-existing conditions and just overall health. That's what it seems like.
Right.
Yes.
Okay, so yeah, we got to fix that. So all right, so I want to ask this in two parts. See, Stevie, you rubbing off on this now. So, so I want to ask this in two parts. But as you start talking, it made me think. So could you break down, like, so we're talking, this was moving into talking about getting the flu shot and why the flu shot is important. But could you help us understand what's in the flu shot? What is the flu shot? before we get into why people should take it.
Okay, as I mentioned before, each season, the flu shot is made up of what the specialists predict or can try to imagine which strain of the influenza A or B may be prevalent for that year. What they do is to, based on that information, they come up with a combination of antibodies or components that will help to fight off the strains that they think will be prevalent for that year. So each year, there's a different batch of flu vaccines that are made up based on what the prediction of the prevalence of whichever influenza strain may be prevalent for that year.
Okay.
Hold on, Joe. I got a question. Is there a difference what's the difference between the high dose and a regular dose? So, and what should they know about getting the different vaccines, or what should they ask their provider? Do they qualify for a high dose or not?
Okay, so there are the regular dose, which is recommended for anyone aged 6 months or older. And with the regular dose, it will help to protect the immune system of the age groups that the vaccine is made up for. For the high dose, we usually recommend that for patients who are older than 65 because it is more effective and it is stronger than the regularly dosed influenza vaccine.
Okay.
So now, Dr. Foster, I mean, I think as providers, you and I have heard, and even Joe and Mathias, we've all heard patients say, "Oh no, I don't want the flu. I don't want the flu shot. That gave me the flu."
Yeah.
Right. That was my other question.
And
Yeah.
so,
Right.
So
That's why I broke that up like
can
that.
you elaborate why the flu vaccine is not going to give you the flu?
Okay, so the flu vaccine is meant to allow your body to build up your own immune system against the influenza virus. Remember what I said, they try to put components that they believe that will be prevalent for that year. So in boosting or allowing your body to build up antibodies against the strains that are predicted, when you receive the flu vaccine, you may get a little bit of a scratchy throat or you may get a runny nose, but you will not get the actual influenza virus. Your body is just reacting and building up the antibodies to be able to fight off the actual influenza virus.
Right.
So, like I mentioned before, there's zillions of other viruses. There are Epstein-Barr viruses. There's so many. Oh my gosh, there's zillions of different viruses, and it may be a coincidence that someone may have contracted another virus that may be similar in symptoms to the influenza. Okay. So the influenza vaccine does not give you the influenza virus, and it's better to have a little runny nose or a little scratchy throat than to actually have the full-blown influenza infection, which can cause most people to be laid in bed for sometimes up to 2 weeks.
Yeah.
Okay, hold on. I got one more question.
Go ahead.
What are the side effects of the flu? So people know, because some people say, "Oh, I'm allergic." How do you know if you're allergic to the flu? Like, what side effects or things you need to look for? Because you never know they're injecting it. So what happens? Like, how do you know?
What are the side effects of the flu vaccine?
Yes, ma'am.
Okay. I wouldn't necessarily call it side effects. I would call it more of potential quote unquote complications, which are not really complications, but it's the body's reaction. For one, you're being injected in your arm typically, so you would get pain at the injection site.
Okay.
Some people may develop a fever. Other people may have an acute reaction. And for those patients who have been known to have an allergy to any component of the flu vaccine should really not have the flu vaccine. And those are rare, very rare occasions. So because of how they do make up the vaccine, there are components such as eggs or the gelatin that's used that can cause an acute reaction. So, and also, I'm not sure if people have heard of thimerosal, which is one of the preservatives that's used to protect, to allow the vaccine to last a longer period of time. And some people may be allergic to the thimerosal. So there are types of vaccines, the influenza vaccines, that do not have the preservative or the thimerosal-free influenza vaccine virus vaccinations. So, did I answer your question?
Yeah. So, in the next, because it's basically what we try to preach is you knowing what you're going in for, being able to ask questions, even if you don't understand. Because I just learned a couple things about the components of the flu shot.
Right.
So we have to do a better job of asking what are the components of it. And if somebody can't tell you the components, you might, well, let me learn the components and then come back. Would you recommend that?
Yes. Or, even if you don't know the specific components, because it's kind of sort of like asking an attorney about a legal matter. And for example, me, I have nothing to do or no knowledge of the law.
Right.
Right.
So when they explain to me, something that I may ask, I may not understand. So we can ask questions that we can break down into layman's terms so that, you can be fully informed and aware of what you would be getting in terms of once you receive the flu vaccine.
So you hear
this
that,
the last-
folks? Please, please, please ask questions. Don't just cut us off at the knees when we mention the flu vaccine. If you have questions, if you've heard things from the street committee, please, please, the providers are the people to ask. And please ask your questions. So
and normally what I do is there are a lot of patients that will say, no, I don't want the flu vaccine. And, I will follow that up with, why don't you want to have the flu vaccine? Because especially this year with COVID-19,
right,
the demand is going to be significantly higher than in past years.
Right.
And we may not have enough of the vaccines to go around because we order a certain amount predicting that we'll use that certain amount. But because of COVID-19, a lot of patients do want to receive the flu vaccine to have that added protection so that if they do get COVID, that their immune system will be boosted. So I usually follow that up with, well, why don't you want to have the flu vaccine? And 90% of the time they will say, I'm allergic to the flu vaccine.
yes.
And true allergies, like I mentioned, are very, very rare.
Right.
One other potential disorder that may be considered is a syndrome called Guillain-Barre Syndrome, which is a neurologic disorder that can cause paralysis. And Guillain-Barre Syndrome is extremely rare. So the likelihood of having a quote unquote allergy to the flu vaccine is very, very rare.
So, okay.
Well, you know, Dr. Foster, I always look at when I see the viral family, somehow they're all related, whether or not there's a virus that's very close together in structure or whether or not they're far apart, but they're somehow related. Can you give us, since we discussed the flu, can you tell us about the coronavirus and can you also elaborate and tell us how the 19 got there?
Sure. Okay, so the coronavirus, the actual name of the actual virus is SARS-CoV-2, SARS-CoV-2.
Right.
And that's the name of the actual virus that causes the COVID-19 infection.
Right.
Now, the World Health Organization learned about cases initially that came from Wuhan, China, and this was discovered in December of 2019, and therefore the COVID-19, because it was discovered in 2019.
Okay.
So I'm glad you broke it down like that, like the way you did, because we try to make sure people understand what we're saying. So HIV is the virus, and AIDS is the disease or the syndrome that would come from it. So SARS-CoV-2 is the virus, and COVID-19 is the disease that would come from it.
Exactly.
Make sure people understand those. Okay, and because it came out in 2019, that's how I got the year on it. So,
Yes.
It was always one like they just put numbers.
That's right.
19, like this must be the 19th version or something, you know.
Right.
Because there are a family of coronaviruses, and the reason why it's called quote unquote coronavirus is because the actual virus, or the virion as we call it, has little projections called spikes that are all over the surface of the virus itself, and it looks in structure like a crown. So therein comes the corona, which is crown-like in appearance.
Right. Okay.
So is it true that, you know, I heard that the HIV virus and the coronavirus, they may not be brother and sister, but they are cousins, because their structure, I saw a talk with Dr. Fauci, and he broke down the structure, of the coronavirus. We think the HIV virus is complicated. The coronavirus is complicated.
It is very complicated, and a lot of people don't realize the viruses usually are very dumb in the sense that the structure typically of a virus is not very complicated.
Right.
It has a DNA or an RNA, and it has the cell that surrounds it. Bacteria are a lot more complex, and they have more components within the actual bacterium itself. This particular virus is in the family of the coronaviruses. The components are complex, and not just the components, but the mechanism of and the pathophysiology of how it infects the body is appallingly similar to HIV.
Yes, which is the reason why, I mean, people we're dealing with the antivirals, but if people notice, we don't have a vaccine for HIV because it is so complex.
Right. And just to go into a little bit more detail with the coronavirus, it typically is contracted by droplets from either the nose or the mouth of someone who is infected those droplets may land on someone else. It may land on a surface, and depending on the surface, it may last up to several days.
Wow.
So therein lies the reason for constantly disinfecting and cleaning surfaces. So if a person who is infected has a droplet that you touch or is transmitted through any of your mucous membranes, once it enters into the body, it goes into the bronchial tubes and it finds its way into the lungs and into the little tiny pockets called alveoli where oxygen is exchanged. This sneaky little virus, what it does, once it gets into the body and enters the alveoli, it enters the human cell, the alveolus, and replicates. Yeah. And once it replicates, it buds off and kills the cell that it infected. Mm-hmm. That's the major reason why people die and have such major breathing problems when they're infected with COVID, because not only are they killing the human cells, but it's replicating by hundreds, and each of those replications therein go on to infect the other lung cells and damage the lungs and cause mucus to be produced. And that's the reason why it's been described that people who have a COVID infection feel like they're suffocating, like, you know, they can't, they're struggling to breathe. That's the reason why they end up on respirators.
Right.
Okay. Because she kind of answered my next question, like how do you really contract COVID? But you explained the whole droplet process. Right. And then you actually went into the process of the life cycle of COVID. So right. Just like a few things, like if I'm, saying not that smart, I'm the average Joe, or, even some people who are smart, they really don't know how long it lasts. So like if you say somebody sneezes around you and the droplets fall and you try to wipe off the counter, how long do you need to clean? Like, what are some things we need to do if like we out there? Because you go to the restaurants and stuff, people scared to cough. They scared to sneeze.
Yeah.
What do you do in those situations? Like if you're out and about and somebody says, "Achoo," what do you, I don't want you to start running.
Right.
What do you do as a person?
Well, first of all, that ties into our responsibilities when we do go out into the public. So for one, everybody should be wearing a mask.
Mm-hmm. Everybody.
So
with the nose covered.
Everybody should be wearing a mask. That's correct, Mathias.
Not like this.
Not like that.
And in wearing a mask, it does help to protect not just, yourself, but if you do sneeze, at least it's contained within the mask. Right. Another major thing is to be socially distanced. So if someone does cough or sneeze and those droplets potentially can cause you to be infected, then then because of the distance between yourself and that potentially infected person would not really affect you. So that's the reason behind the recommendations that we have seen that have been through the CDC and the World Health Organization and other healthcare professionals.
Okay, I'm glad you hit on that, because I was always thinking that, because I was like, okay, a sneeze travels 12 feet. They're telling us to stay 6 feet away, but you're saying the efficacy of the virus or the strength of it, the further it goes, the weaker it gets.
Not necessarily. It's more of the load of how many viral particles and the well, the ability of that individual's person to respond to get rid of it, for one, or as you know, there's some people who have absolutely no symptoms, and that same person who sneezed or coughed may not have had any symptoms. So you never know who around you may be infected.
Which is why you wear the mask.
Right.
Exactly. And social distance.
And social distance.
Now,
And also use hand sanitizer,
Hand
not
sanitizer.
next to, a running tap.
Right.
Yes.
I got a question. So, okay, since they opened everything up and you see a lot of the elderly population and some of the younger they're wearing gloves. Like,
that's a good idea.
They wear the gloves, but they're touching everything and don't change the gloves and then change the face. So it's like, to me, is that spreading the virus even more? Or what do you tell the people with the gloves? Do you sanitize the gloves because they don't want to take it off? But
okay. You know what the trick of the glove is? To protect the person wearing the glove.
Right. That's it. That's it.
So,
gotcha.
I have worn gloves initially when, we were warned that our numbers were going up locally here in Tallahassee. I would wear gloves and go into the supermarket. So if I touched a box of cereal that somebody with COVID just touched, my hands are protected.
Okay.
I'm not really, in terms of trying to look out for other people, that's fine. But if I pick up that box and that box is contaminated, when I get home, I need to make sure that whatever I do is to be as conscious and aware of not contaminating the rest of my family by even putting the box on the counter, the kitchen counter. So there again, you are helping to, with disinfecting constantly, you're removing the possibility of the virus laying around on surfaces. But in terms of the glove protecting others, it does not. It only protects the person wearing the glove.
Right. And I've actually seen people who have the gloves on are touching everything and then will touch their face or put something in their mouth.
Therein lies the problem. And it's just like if you didn't have a glove on. So if you're going with your bare hands and you're touching everything and you touch any of your mucous membranes where it can enter into your body, it's just as bad. So whether you have a glove on or not is not going to help to protect anybody else but yourself.
Right. Now, one thing you said, like I appreciate you going into the actual life cycle of the virus, the virology of it, because for those who are watching this who may still believe some of the things, like one of the biggest things I just can't get over. I'm not understanding how people really brought into a 5G tower emitting a virus over some distance going to another tower when, like you explained, the virus needs a living biological host to stay alive. So I just want to get people to understand that.
For months.
Right.
So like I said, though, depending on the surface type, it can live on surfaces which are non-living for weeks.
Right.
Yeah.
Interesting. That's interesting. Dr. Foster, I was reading an article the other day, and I thought it was, and I can't answer this question, so maybe y'all can help me. But COVID-19 has been found in semen, and so they said it's been found in fecal material and in semen, and so. The question I asked myself, but now I'm posing it to you guys, is it now considered a STD?
Oh.
Well,
I mean,
I have not seen those studies, Elena. However, if you consider an STD which is transmitted sexually, whether it be oral, anal, or vaginal, then that's something that will need to be explored.
But Ms. Steeper, also, if you're having sex, you're normally kissing, so you're not 6 feet apart. You're normally exchanging saliva and stuff. So,
but it was found in semen.
Yeah.
Semen and fecal material, and it was in the article was in JAMA and in Lancet, and so I was like, well, if someone contracts it, if a male or a female becomes infected via semen, is it a sexually transmitted disease, and is it treated the same way? But that was just when I was reading the article.
You know, there's so much that we have left to understand about this virus that it's, you know, because it's less than a year that, you know, we became aware of this virus. So,
yeah,
you know, research and continued investigations about this virus, like you said, is a complex virus, will continue for years.
I see.
I see it too.
So when it comes to symptoms, I know when COVID first broke out, it was the runny nose, the coughing, the fever, and the difficulty breathing. And then it looked like within 2 weeks the list exploded from 5 things to 55 things. That's what it seems like. But so what are some of the, like, still to this day, what's still the most common symptoms and signs of COVID that one can recognize?
So the original symptoms, like you mentioned, a fever with a temperature over 100.4 degrees, chills, sore throat, cough, shortness of breath, difficulty breathing still remain. Subsequent to that, they've added a few other things. And you know, like we mentioned before, there is a lot of crossover in symptoms with other viruses. So even the influenza virus can give you body aches and pains, feeling tired or fatigued all the time, and as well as any congestion, runny nose, or headaches. One of the things that they added later on was a new loss of the sense of taste or smell. And the last thing that they added was nausea, vomiting, diarrhea. So, you know, these all are symptoms that pretty much any virus you can attribute to any other virus, but these symptoms in addition to the history of being potentially exposed to someone who had COVID-19 would prompt the provider to order a test for COVID-19.
Okay.
Wow.
Appreciate that.
That's a lot of information, just great information to really just sit there and digest and kind of sort of just be there. This is almost like a springboard that will allow a person to go and investigate COVID as well as influenza a little bit more, so that they would have, this is a great little, I guess you can say, several gold nuggets, you know, that a person can take and they can investigate it a little bit more.
And knowledge is always, you know, powerful, because if you are knowledgeable about the way it's transmitted, you'll be more careful about making sure that you do the measures that the healthcare professionals have recommended.
So what words of advice would you give someone who says, you know, I really just don't believe that a mask is going to prevent me from, catching COVID. And I'm sitting on the fence regarding, especially, Black people have a caution with the healthcare system. So because we have been involved in experiments we had no idea we were involved in. So what would you say to someone who is just kind of sitting on the fence about the measures to keep themselves safe?
At this point, we have enough evidence and enough information to know that there is evidence of wearing a mask being effective. Using or washing your hands or using hand sanitizer on a regular basis is effective. And social distancing has been shown to be very effective in terms of limiting your exposure. So these are things that we have come to find out through studies within Wuhan itself, because they were the ones that first were exposed to this virus, and through autopsies that have been performed, we have gained a lot of knowledge at this point, and those are the key things that we know for a fact. It's not a myth. It's not a theory. Right. It's a fact that these things have been proven to help to reduce your chance of contracting COVID-19.
Okay. Right. You hear that, street committee?
Yeah.
It's amazing how the street committee so quickly became coronavirus or just virus first.
Yes.
Everybody had the cure, everybody had this, everybody had that. And I'm sitting here like, well, I know I work at a medical facility with medical professionals who are still learning this virus at the time. So I'm still not understanding how people just become automatic experts. But that is one of the things that we're fighting against when we go out and talk to people. So that's why we're grateful that you are here to give us this information.
Yeah.
You just arm us with more ammunition to educate our community properly.
And it's my pleasure because, like I said, information, if you have the information, you have the informed consent to know what you need to do to protect yourself and your family. Even if you don't really care about being infected, if you're a younger person and think that, oh, I'm healthy, I may not, even if I get it, I won't die. That myth has been dispelled because anyone can develop the severity of the infection. And like I mentioned, once the virus gets into your system, you do not know how it's gonna potentially, infect that person's body. There've been children, teenagers, and young, very healthy adults who have died from COVID-19. So we're still learning a lot. There may be different subtypes of COVID-19. There's still information out there that we do not know for sure, but we are continuing to gather the information every day. And I'll add, this is, I guess, to me, breaking news, because I just heard this last night. There is a 14-year-old young lady who potentially may have the cure for COVID-19. She is but 14, very articulate. She has discovered, remember I told you there were spike proteins on the surface of the virus? She has discovered a solution that will help to penetrate the surface proteins and potentially kill the virus.
All right.
So listen out for more information about this, but she is awesome and very articulate, and it's young scientific minds who are constantly researching and trying to investigate and learn more information about what we can do to help to get rid of this infection.
That's great.
That's right.
14 years old.
That one up now.
Yes.
Wow.
Yes.
Wow.
Joe, we know what we're doing after this.
I know, right? Doing our research. But I want to make sure everybody who's viewing this really take in the information. We was writing notes. Please write notes.
That's right.
Utilize this information.
That's right.
This is not street committee information. This is not some fly-by-night information that we would just have go in one ear and come out the other. It's not social media. This is not a meme. This is set up so we can give real accurate information to potentially help save lives.
That's right.
Because we're already in a dire situation where our country, we're supposed to be the most medically advanced country, but we have the highest number of cases and the highest number of deaths out of all the countries in the world. So we want to make sure that we're doing what we need to do to take care of ourselves. And why not expose you to someone like Dr. Foster, who is she's great at what she does, and she knows her information, and she can help yourself. So with that being said, Dr. Foster, if somebody wanted to contact you for another interview, or that you want to get in contact with you with just more information, how can people learn more from you or get in contact with you?
Well, I am at Neighborhood Medical Center, and we have 5 locations. And if you contact our main location, which is on Brevard Road, the number there is area code 850-224-2469.
Okay. To Mathias, that's your cue. Do all the runoffs. Do you know all the addresses, the numbers, everything?
Y'all really want me to go through it?
No, we'll put it in the comments in the description section. But thank you, Dr. Foster.
Yes,
and thank you for allowing me to spread some good information. And like I said, once you're informed, you're able to protect yourself,
right, and others
a lot better.
Right.
And now we know what to tell people about the flu. Because I'm telling you, Dr. Foster hounds us in every meeting, everything. Don't forget the flu shot.
Right.
So just be like,
right.
Okay, that's so right. Everybody I see, I'll be like, did you get your flu shot? The next patient. So they be like, you really on me about this flu shot. They'll hear from me, then they'll hear from Miss Steeple, and then they'll be like, you know what? Okay, I'm tired of this. Let me just go ahead and get this flu shot because they're going to keep asking me.
And it's not as bad as some people think, because I have patients who resisted getting the flu shot once I explained what it does and what, purposes and benefits are of the flu shot. They ask me following years to get the flu shot. So it's a win-win for everybody.
Yeah, because I got my flu shot and I didn't feel anything. I didn't have any symptoms or nothing. It just was like, okay.
That's right. And I will say this one thing is that the question goes, am I my brother's keeper? And I go, yes. This whole public health situation is a chance for us to look and take care of each other. And we all recognize when we were locked down how much we really miss seeing, and really even being even in the clinic, for those of us who are working at home, we miss a certain level of camaraderie, but we do need to look out for each other. We do. We really do.
We miss you too, Miss Steve.
Y'all working from home, but we miss you.
So
thank you so much for
having me, Dr. Foster. Really appreciate
it. We thank you for coming out.
Right.
And if there's nothing else or any other questions y'all can think of.
Well, so remember, this is Mind Your Body and Soul, the Healthy Podcast. We are available every Wednesday. It's hosted by myself, Joseph Ward, Mr. Mathias Sweet, and Miss Elena Steeple. We're an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may or may not have access to. Remember, we seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of ourselves. Every Wednesday, we're available. Check out our website, nmcpodcast.com. And also make sure you check out our Neighborhood Medical Center our Neighborhood Medical Center website at neighborhoodmedicalcenter.org. That information is in the description. Also, subscribe or check us out on your favorite podcast platform. We're on Anchor.fm, Breaker, Radio Public, Pocket Cast, Spotify, and Google Podcasts. And we're coming for all the rest of them as well. So with that being said, we will see you guys next Wednesday.
Bye.
All right. Bye.